Why don't you start out by just telling everyone who you are and,
Sure.
and how you became involved?
I'm Dave France, and I am a partner with the law firm of Stinson Leonard Street. I got involved in LLS. My nephew and godson, Mike Skinner, was diagnosed with leukemia in 1980, and he died in '84. And I reacted that pretty angrily. I didn't want to touch that. I didn't want to have anything to do with it. It was probably a couple of years before I'd even drive on Rainbow past KU, which is where he passed away. And Jimmy got involved in the Leukemia Society at the time. And I remember he kept talking to me about it, and I just said, no, not my thing, not my thing. And in 1991, he came to me and he said, I had chaired the old Spirit Festival a couple of years before, and he came to me and he said, we got this really cool event. I'd just like you to look at it. And it was a new event called Breakfast with the Champions. And he asked me, and then we sat down to lunch, and Jana came to us and asked me to chair the event the first year. And eventually I decided to do that, still somewhat reluctantly, but that's how I got involved in the society.
Great. So through the years, you have chaired the ball, you chaired Man and Woman, you were Man of the Year, you were board president, you were the national board president. So you have gone through the entire gambit of the organization. Can you just share with everybody some of those things? And I'm sure I've left stuff out because, between golf tournaments and celebrity waiters luncheons and all the crazy things. But don't forget the Jim Wilson slide because we're going to show a picture of you in it. So just, kind of say through over the last couple, decades, I've done numerous things on the fundraising side, and then we're going to jump. Particularly, I want you to delve.
After I chaired the Breakfast with the Champions, I stayed on that committee for a number of years and became more and more involved in the society. I think in a year after that, I went on the board for the first time and served on the local board. I started getting active in some of the fundraisers. I did the Man and Woman of the Year. I think the first or second year, it was the second year it was done, and was the successful fundraiser and became Man of the Year. And remember how I still have pictures somewhere of my picture up on billboards all around the city. That was great fun. And then my wife and I, we together did a marathon. Walked it, didn't run it, but we both walked a marathon, trained for months to do that, and then ultimately I did 2 more marathons. My daughter did a marathon as her senior school project in high school, and ultimately that was the topic of her college essay that she wrote about learning about what it's like to give back. After that, I chaired the ball in one of those years, and I remember I became local board president and went to a Midwest board president's meeting. Jan and I went to that, and we were at this meeting, and we heard this discussion about a new event that the Minnesota chapter was doing. And we had been talking for years about we needed a walk. We needed to do a walk, but it had to be different. And I remember we went and heard about Minnesota doing a walk at night. And they carried balloons, and the balloons were different colors for recognizing people who had the disease, who had lost somebody to the disease, and who were supporting. And I came back, and we walked out of that session, I said to Jenna, we gotta go do that. And so we got the beta of that outside of Minnesota. They decided to try to extend it to some other chapters. And the first time we did it was down on the plaza, around, went into maybe westward a little bit, but down Brush Creek and around Mill Creek Park there in the fountain. And it was really, really a neat event. It was a signature event. I could tell even then it was going to be a great event. And so I stayed active in that, raised money to participate in that for a number of years. It was took a lot of flack from people who were very willing to give me money to go do a marathon and think I was about to kill myself, but they didn't want to give me money just to do a walk. And so, but I remember just pushing it and doing that and raise money for that event for a number of years. It was great, a great event, and I think that it's still one of the signature events in Kansas City. I became chapter board president, as he said, in 2000 or 1997 or 98, I think. And at that time, we had a national structure where every chapter had a board member. And I was elected to the national board in 2000. And it was really an education for me to learn about everything we did. I knew the fundraising side, understood that, but I didn't know all the other things that Leukemia and Lymphoma Society did. We didn't have much patient research here at the time, and so we didn't see a lot of the funding from research. And I remember thinking, well, we have people who could raise these monies. We had the Stowers Institute, and we had other institutions that were certainly capable of receiving funding. And so I set about trying to make sure, my second hat as a Kansas Cityan was trying to make sure that there were opportunities to see that LLS was engaged in Kansas City. I ultimately ran for and was elected the national board chair in 2006. My term was 2006 through 2008. Was the first time while I was board chair that we had $300 million in revenue nationally. I'm still pretty proud about that. But I remember we were doing a strategic plan session in 2004, and we were talking about what we were doing and how we were doing it. And I remember asking at one of the meetings, I asked the question, well, are we really doing the best we can to deliver as soon as possible cures to our patients? Because if our research isn't doing that, it may be good for science, but it's probably not good, the best thing we can do for our constituents. And the result of that was we put together a program called the Therapy Acceleration Program, TAP. And we took TAP, and what TAP did was it was in addition to our normal research program, and it was really focused on finding things that were going to deliver cures and treatments to our patients sooner rather than later. It wasn't the, gee, we're going to discover something now in a lab and 15 years from now there might be a drug or something. This was, we found this thing, it can make a difference, and we're going to get it out there. And so Therapy Acceleration has been a very aggressive program of LLS, and I think it's been a differentiator for LLS. It's something that made us different.
One of the other things that Kansas City, because I think for you, I've never seen anyone who can set a goal and swear to God 15 years later and you're still talking about you've gotten one step closer until you hit that goal. It has been such a life lesson for me. I tell people about it all the time. So share with them that. This is so emotional going through. This is like 27 years of flashback. Yeah. We used to sit on the phone like an hour a day discussing all this stuff, and it's happened. And I see it happening, and I'm like, God dang, I don't know anyone. And I don't know anyone who can hang on to something for so long and make it happen like Dave does. It's like, it's so inspiring. So I kind of want you to share, how did your vision start, and what was the vision?
Well, I've been blessed in my life. I've had lots of opportunities that a kid from Raytown I didn't think would have. And I remember a partner in our law firm, and he told me one time, he said, service is the rent you pay for the space you occupy on earth. And he said, if you're going to be have an opportunity to be of service, you've got to take advantage of that opportunity, and you've got to do it right. You got to invest the time and the effort to do that. And, I believe in that. And when I remember, I'd come back from that same strategic planning session talking about where we were going. And Lou DeGennaro, who was at that time was the chief scientific officer, and now he's the CEO of LLS, he had this chart, and it was explaining how drugs get developed. And he had this picture called the Valley of Death. And it showed the movement of the thing going across. And a week later, I was at a breakfast meeting here in Kansas City, and they were talking about the need to develop life sciences in Kansas City, and how we had Stowers Institute being this great opportunity to really build Kansas City into a hub of life sciences and in the medical field. And he pulls out this chart that he puts up and it is the same chart that Lou had. It was turned sideways, but it was, here's the process and here's what we're doing. And it showed, and it was Irv Hockaday who was giving the presentation. I called Irv afterwards. I said, Irv, I've got the LLS strategic plan that I've been working on, and you guys stole our stuff. And he kind of laughed, and he goes, what do you mean? I said, I'm gonna send this to you. At the time, it was a fax. I faxed him this copy of the pages of our strategic plan, and I'd highlighted like 4 things that were, and one of them was drug development. And he called me back and he says, this is pretty amazing stuff that you're doing the same thing at a national level that we're trying to do here in Kansas City. And he said, do you know about KU's drug development program? I said, no, I don't. He said, I need to set you up with a guy named Scott Weir, and you need to get with him. And this was in 2006. And so I go to Irv's office, and there's Scott there, and we're kind of comparing charts that Irv had taken his chart from Scott, and Scott had the identical chart and I thought, boy, Lou and Scott have a lot in common, and we need to get those 2 guys together. And one of the things I've found is that I know people, and I love connecting people. And so I called Lou up and I said, Lou, I know you've been looking for a drug development program in the academic world. Have you looked at KU's program? And he said, no, I didn't know about it. And I said, well, you really need to come out here and look at it. And I remember I was out of town the week he came in on a trip, and he called me when I got back, or I called him when I got back, and I said, well, how'd the visit go? And he said, my meeting was on Wednesday, and on Tuesday night I was sitting in a hotel room there in Kansas City, and I am thinking, God, I hope I don't have to tell my board chair that a program that he really likes is really not a very good program. And he said, well, thank goodness I don't have to do that, because this is the best academic drug development program I've seen. And we're going to partner with them. And so LLS came in and has been a long-term partner with KU, and they've come in with the National Institute for Health and the National Cancer Institute, and they worked on drug development. And that was something that happened just because I heard a speech at a breakfast and connected the dots and put the people together. And I like that. I didn't understand any of what they were talking about, but I laugh about that. I remember I used to go to those national board meetings, and we'd have these presentations from these young academics, they were doctorals or postdoctorals or whatever, and they'd have these little poster things. I'd walk through and they'd start telling me, well, I'm analyzing what the allocation of the receptor gene, blah, blah, blah. And they'd start telling me, and in about 30 seconds, my head is swimming, and I'm going, without any clue what they're saying. And I remember I always used to say to them at the end, I am just really proud that I can raise money so people as smart as you can go do what you do and help us find cures for these diseases.
That's the great soundbite right there. I needed to snip that entire forward.
I believe that the biggest thing, if I had to identify one thing that I think I helped with in the LLS effort, I think it was taking the idea of the need to do something quickly. And, it's very much of a businessman's perspective versus an academic's perspective. But I remember always thinking that I don't want to be about finding a way to give somebody 4 more weeks of life when they're in terrible pain. That's not success to me. And you know, we always talked about all this research that we were doing would have incremental benefits and would move the needle a little bit. I think we've turned into an organization that isn't trying to move the needle a little bit. I think we're trying to shove the needle far ahead. And I think drug development, repurposing, you know, the fact that the National Institute for Health looked at what KU and LLS put together and held it up as the model in the country. And you know, under Obama and with the then Surgeon General, he said, this is going to be our model of how we're going to develop drugs. We're going to repurpose drugs and save that money. And it's faster and it's more efficient, but it's market driven. And we weren't looking to develop something new. We were looking to find ways to cure people. And I think that has become the focus of LLS, and I'm proud that I was part of helping turn that attitude around and change that philosophy.
Just as a note, they're probably gonna wanna come in and set
Okay.
up
So, what drives you to continue on?
What drives me to continue on is that we're not done yet. You know, when my nephew lost his life, we cured 50% of people with his disease, and now we cure 90%. But we still don't cure 100%. And you know, one of the things that I think we're starting to look at now, and I think rightfully so, is long-term impact. I had a friend who passed away recently, and I didn't even know he had had Hodgkin's disease as a child. But what happened was the radiation they gave him damaged his heart, and he died at age 56 because his heart gave out. Well, we need to be dealing with those kind of things. And so we're not done yet with the thing. The other thing that drives me is I'm a Kansas Citian, and the opportunity that we can have the core center of a lot of these things. I remember the first time I met Roy Jensen from KU Cancer Center. I told him, I said, I just want you to know that KU Cancer Center is going to become one of the foremost blood cancer treatment centers in the country. And he kind of looked at me, I said, because I'm just not going to stop till we do. And he laughs about that now, but that's my plan. I intend for Kansas City, we have great academic and drug development and research here, and we have facilities in Arkansas and Nebraska and St. Louis and Kansas City, all of which are in this space. There is no reason that everybody in the U.S. should think about coming here instead of going to MD Anderson or the Hutch or Dana-Farber or any of those other ones. And so that's what drives me, is to see that happen.
One thing is there any way?
Because they're the presenting sponsor of the event.
Right.
So.
Well, then we might wanna mention Children's Mercy as well then.
So
Don't you think?
I think if you could say something about, you know, the goal.
Where I was, and I'll just finish, and he'll have to figure out how to put it together.
Yeah, but basically just say so many of the hospitals are.
Give us a couple more minutes.
We have 2 more minutes. Just say something to the effect that, you know, the whole region is stepping up to bioscience.
I got it.
Okay.
You know, for example, I've been working with Children's Mercy recently and their partnership with KU, and you know, Children's Mercy does a huge number of pediatric bone marrow transplants. You've got KU that does a huge number of adult bone marrow transplants. We have treatment in this city, not only the KU Cancer Center, but we have great cancer treatment at the HCA hospitals. We have great treatment at St. Luke's. All those places, you can come to this city and you can get treated. And that's a direct result on elevating this community in cancer treatment.
Perfect. Nailed it. You can have this, getting this honor, being honored tonight mean to you?
Well, I loved the ball. It was my mom's favorite event. It was my mom's favorite event, and we used to come with her every year. And so to be recognized as having something to do with the ball in particular, or in this chapter in general, it's just a great honor. So, I mean, I'm humbled.
And I have a picture of your mom that will be, I don't think we brought it today, but